Today, actually, after a long time, I have come to make a video for a very short type of video. So, very interesting video. Actually, I will not discuss so much. The most important topics. Actually, sometimes in our daily activities, the daily household activities, sometimes what happens, exactly, we normally encounter some odd situation like suppose a person is eating his lunch or dinner, and after eating lunch or dinner, suddenly the person falls down and gets fainted. So what is the scenario? The suppose this is the person, and he is eating his lunch or dinner. But after completing the lunch of dinner, when he is getting up, when he is getting up, when he is getting up, he faints down. That means he fell unconscious. So he fell unconscious. So there are three scenarios. There are three scenarios. One is number one scenario. What is that scenario? The person is taking his meal, heavy meal, mostly heavy meal or light meal, maybe. Maybe it is breakfast, maybe it is lunch, maybe it is dinner or supper. After taking the meal, he is getting up from his previous position during the meal. So when he is, suppose I am the person, I am just taking the meal, breakfast, and after taking the meal, I have to change my position. So he has changed his position. So during changing his position or after changing his position, suddenly the person gets fainted or fell unconscious. So what is the scenario? Actually, this scenario is very common in our very day-to-day practice. Actually, this type of scenario is known as post-prandial hypotension. So could you tell me what is post? Post means after. This is like the prefix. Pre means before and post means after. So prandial means food, after food. Actually, food or after food. Postprandial hypotension means low blood pressure. So when the person is taking his meal, suppose his blood pressure reading is normal 130 by 80 millimeter. But after taking the meal, the systolic blood pressure mostly gradually decreasing or gradually falling down. So when the systolic blood pressure is gradually falling down, normally, just come to this point, suppose the patient is taking the meal, number one position, number two position, and number 3 position. Suppose this patient is taking the meal and this is the number 1 position. Now the blood pressure reading is 130/80. It's absolutely normal. Systolic blood pressure is normal and diastolic blood pressure is normal. So systolic blood pressure is normal means his heart is pumping well, and his heart is pumping well and sending enough cardiac output to his brain, so normally he is conscious. But after taking the heavy meal the cardiac output is gradually decreasing. The cardiac output normal, but here cardiac output gradually decreasing. So when cardiac output is gradually decreasing, normally what will be the problem? And normally his brain is not getting enough blood. And you know, your brain solely dependent upon 2 things. Lots of things are there, but mainly 2 things for proper functioning. One is oxygen, another one is glucose. So when here the blood flow is lesser towards the brain, normally the delivery of oxygen and delivery of glucose is lesser here in the case number 2. In the case number 1, look at, in the case number 1, the pressure is normal, the cardiac output is normal, so approximate 10 to 15% of cardiac output will be delivered to the brain and it's absolutely normal, so the patient is conscious because the brain is getting enough blood and glucose. But in the second case, when the cardiac output is decreasing, normally lesser amount of the blood is going to the brain, and when the lesser amount of the blood is going to the brain, normally the brain in the 2 number case is not getting enough oxygen and nutrition. So automatically the brain function will be diminished. So when the brain function will be diminished because of the lacking of the oxygen and glucose, normally the person fall unconscious. Since this situation or these happenings occurs after taking the food, that's why this is the term that is called postprandial hypotension. So what is the basic pathophysiology of the postprandial hypotension? Actually, it is not cleared properly, but it is commonly seen in the aged population. Mostly, it is geriatric group of the patient. That means those patients or those population more or less greater than 85 years of age. Could you tell me one thing? What are the basic physiological changes occurs in an aged person? Look, from birth up to 25 years, everything getting constructed, everything getting built up But after 25 years, everything getting gradually destructed. That means the destruction process has automatically begun. So at the 85 years of age, normally the cardiac function or cardiac output is not as much as a younger age, as that of younger age. So cardiac output will be decreased because heart muscle contractile power is decreased. That is called systolic heart failure, or sometimes heart muscle relaxing power will be decreased. That is called diastolic heart failure. So as we age, normally heart muscle contraction and relaxation power will be gradually decreasing. Second thing, our brain is the master organ. So automatically when we age, normally our brain cell will be gradually decreasing. That is called atrophy of the brain. So brain also controls the heart. So when brain will be atrophied, normally that bad effect will be directly reflected onto the heart. Number 3 problem. Normally at this age, at this aged person, or at the point of this age, normally person suffering from the associated comorbidities like diabetes mellitus. This diabetes mellitus is very, very dangerous. It's called the silent killer because it attenuates or it weakens our autonomic control, autonomic nervous system. And this autonomic nerve, especially sympathetic nerve, exactly controls the blood pressure. Actually, after taking the meal, all the food will be coming to the stomach. And what is the function of the stomach? To hold the food, to reserve the food. So when the food is coming to the stomach, normally it is giving the pressure upon the wall of the stomach. That means stomach like the bag. And when the food is coming into the stomach will be overstretched. So stomach will be overstretched. And this overstretched of the stomach exactly activates the sympathetic nervous system. So that maximum amount of the blood are coming to the stomach through the gastric artery and superior mesenteric artery, because here food will be churned, food will be digested, food will be absorbed. As well as your baroreceptor will be properly activated by the autonomic nervous system to preserve the cerebral perfusion. To preserve the cerebral perfusion. But due to autonomic dysfunction, due to chronic diabetes mellitus, normally the baroreceptor cannot properly switch or cannot properly regulate the cerebral dysfunction. Properly regulate the cerebral perfusion, as well as cannot properly preserve autonomic nervous system, cannot properly preserve the required cardiac output, as well as the required gastroduodenal perfusion. So normally the cardiac systolic blood pressure will be low after taking food, and at this extreme age body cannot handle this situation properly like the younger person. Normally the person may fall unconscious. Sometimes iatrogenic. What is iatrogenic? Because of the drug. If the person is taking a very high dose of the antihypertensive medication, especially beta blockers, especially diuretics, that's enough. So if they take, normally there will be the maximum chance of the fall. Another important thing, vagal syncope. Vagal syncope, that's also adds the flavor to this postprandial hypotension. So these are the major risk factors, or these are the pathophysiological pathway of the postprandial hypotension. Mainly the advanced stage person fall prey to this situation. Now how to overcome this situation? Look, you cannot decrease anyone's age because you cannot neglect the nature. So what you have to do? You have to give the frequent small meal. Small meal. Suppose this person is taking meal a very large amount at one time, normally more stretch will be coming into the stomach. So more problem will be generated. This stomach stretch related problem is called gastrobaroreflex. Gastrobaroreflex. So if I can give this person very small amount of the food, so this gastrobaroreflex will not be the culprit point here. So that's maybe the better option. Give frequent small amount of the food. Second thing, you have to control the diabetes mellitus. So control diabetes mellitus. You have to avoid those medicines which are very notorious for making critical hypotension. That means clonidine, alpha 1 receptor blockers, beta blockers, so always maintain the hydration level. Proper hydration level is most important, because dehydration also adds more point to this problem. And remember, we must monitor the ambulatory blood pressure, because it is clearly evident that after meal the blood pressure will be gradually decreased over 60 to 90 minutes. So if we monitor or pre-monitor that person who is very much susceptible to this condition, we can minimize the accident, broken heart, broken bone, broken skull, hemorrhage or death. So postprandial hypotension is a very critical topic in case of the geriatric population. We normally ignore, but we have to be careful that that population, so that major accident and major accident related morbidity and mortality can be managed and can be avoided. That's all today. Thank you.